So you're getting close to 65, and suddenly you're hearing about a bunch of letters, A, B, C, and D. Figuring out what they mean is a really big deal. It can affect your healthcare and your budget for the rest of your life. But it doesn't have to be a nightmare. In the next few minutes, I'm going to give you the ultimate cheat sheet on Medicare, explaining exactly what each letter is for so you can make the right choice for you. It's no wonder they call it alphabet soup. It can feel like you're trying to learn a whole new language overnight, but I promise, by the end of this, you'll get it. We're going to break it all down and make it simple. All right, let's start at square one. What most people think of as Medicare is really Original Medicare. This is the program run by the federal government, and it's made up of two parts, Part A and Part B. Think of them as the basic building blocks for your health coverage. Part A is hospital insurance. So let's jump into that alphabet soup, starting with A. Think of Part A as your hospital insurance. Basically, if you're formally admitted to a hospital or need to go to a skilled nursing facility for a short time, this is the part that kicks in. It also helps cover hospice and some home health care. It's the coverage you hope you don't have to use, but you'll be glad it's there if you do. So what's this going to cost you? Here's the good news. For about 99% of people, Part A has no monthly premium. If you or your spouse worked and paid Medicare taxes for about 10 years, you've already paid for it. But premium-free doesn't mean cost-free. When you use Part A for a hospital stay, you have to pay a deductible. In 2026, the Part A deductible is $1,736 per benefit period. A benefit period is a tricky concept. It starts when you're admitted and ends after you've been out of the hospital or skilled nursing facility for 60 straight days. That means if you have the bad luck of having 2 separate hospital stays in a year, you could end up paying that big deductible more than once. So the key takeaway for Part A, it's for the hospital. The monthly premium is usually $0, but the deductible can be a real hit to your wallet. Part B is medical insurance. Next up, we have Part B. If Part A is for being in the hospital, Part B is for pretty much everything else. This is your day-to-day medical insurance. It covers things like doctor visits, outpatient care, lab tests, x-rays, and medical equipment like walkers or wheelchairs. Now, unlike Part A, just about everyone pays a monthly premium for Part B. For example, the standard premium in 2026 is $202.90 a month. That amount can go up if you have a higher income. That's called IRMAA. If you're already collecting Social Security, this premium usually just comes right out of your check. On top of the premium, Part B also has a small annual deductible. In 2026, that deductible is $283. You pay that first, and after that, Part B starts to pay its share. And here's the number that you absolutely need to remember with Part B, is 20%. After you've paid your deductible for the year, Medicare generally pays 80% of the cost for most services. You're on the hook for the other 20%. 20% might not sound too bad. For a $200 doctor visit, your share is $40. No big deal. But what if you need chemotherapy that costs $100,000? Your 20% would be $20,000. For a $500,000 treatment, you'd owe $100,000. And this is the single most important and scariest thing about Original Medicare. There is no cap on that 20%, none. Your financial risk is technically unlimited, which is why almost no one just stops with A and B. That brings us to your most important decision, and there are 2 paths forward from which to choose. Okay, so we've got Part A for the hospital and Part B for the doctor. But we also have that huge, scary 20% gap with no safety net. So what do? This brings you to your first major fork in the road. You have 2 main choices. Path 1 is you can keep Original Medicare, Parts A and B, and then add a couple of extra policies. You'd add a Medicare supplement plan, also called a Medigap plan, to cover that 20% gap. Then you'd add a separate Part D plan for your prescription drugs. Or Path 2, where you can choose a Medicare Advantage plan, also known as Part C. This is a private insurance plan that bundles everything, A, B, and usually D, all into one package. Let's unpack these 2 paths, because this choice really shapes how you'll get your health care from here on out. Path 2 is Medicare Advantage, also called Part C. Let's talk about that second path first, Medicare Advantage or Part C. These plans are offered by private insurance companies that have to follow rules set by Medicare. When you pick a Part C plan, that private company manages all your benefits. The big selling point for Medicare Advantage is how simple and affordable it can seem. Many plans have a zero monthly premium, though you still have to pay your B premium. They wrap your hospital, medical, and usually your drug coverage into one plan. Plus, they often throw in extra perks that original Medicare doesn't cover, like some dental, vision, hearing, or a gym membership. Another massive plus is that every Medicare Advantage plan has an out-of-pocket maximum each year. This is your financial safety net. It protects you from that unlimited 20% risk you have with original Medicare. So what's the catch? It really comes down to one word: networks. Most C plans are HMOs or PPOs, which means you need to use their list of approved doctors and hospitals to keep your costs down. Go out of network and you could pay a lot more, or it might not be covered. These plans can also require you to get a referral to see a specialist or get their permission before covering a procedure. So with C plan, you get an all-in-one plan that often has a lower premium and extra benefits, but you give up some freedom to choose your doctors. The last letter in our soup is D for drugs. Part D is Medicare's program for prescription drug coverage, and just like Part C, it's run by private insurance companies. You can get your drug coverage in one of two ways, which ties right back to our two paths. If you take Path 1 and stick with original Medicare, you'll need to buy a separate standalone Part D plan. If you take Path 2 and choose a Medicare Advantage plan, your drug coverage is usually already included. Part D plans have their own costs, like a monthly premium, a yearly deductible, and then co-pays for your medicine. But here's a fantastic piece of news. Thanks to a recent law, big changes are happening. There's a yearly cap on what you have to pay out of pocket for your prescriptions, around $2,100. After you hit that cap, you won't pay anything more for your covered drugs for the rest of the year. This is a game changer for anyone with high drug costs. It's really important to pick a Part D plan that actually covers the specific medications you take without breaking the bank. All right, let's do a quick recap of our alphabet soup. The four letters A, B, C, and D are your whole Medicare world. Part A is your hospital insurance. Part B is your medical insurance. Those two together are original Medicare. It gives you the freedom to see any doctor in the country who takes Medicare, but it leaves you exposed to that 20% gap with no limit. That leads you to the big choice. Path 1 is stick with original Medicare and add a Medigap plan to fill the 20% hole and a separate Part D plan for drugs. This route usually has higher monthly premiums but gives you total freedom with doctors and predictable costs. Path 2 is go with Medicare Advantage. This path bundles everything together, often with a low or $0 premium and extra perks, but you have to use doctors and hospitals in the plan's network. There isn't one best answer for everyone. It all comes down to your health, your finances, and what you value more, provider choice or lower monthly costs. But the good news is you're not in the dark anymore. You know what A, B, C, and D mean, and you're in the driver's seat. Making this choice is a huge deal, and you don't have to figure it out all by yourself. If you want to talk about your specific situation with a licensed expert, you can receive a consultation at no cost to you. We can help you compare the actual plans available where you live. Just call the number in the video description below. Thanks for taking the time to get this right. If this video helped clear things up, do me a favor and give it a thumbs up and subscribe for more simple guides to help you understand Medicare and enjoy your retirement.